A late period can definitely send your mind into a spiral, but a delay doesn't always mean pregnancy. Late periods are very common and, in most cases, not a cause for concern. The body is a sensitive system, and even small changes in routine can temporarily disrupt hormonal timing. When pregnancy occurs, the early embryo produces the hormone HCG, which helps maintain the uterine lining and prevents menstruation. Even a very early pregnancy can delay a period, sometimes before any other symptoms appear. For this reason, taking a home pregnancy test is often the first and easiest step. Most modern tests are sensitive enough to detect HCG on the first day of your missed period. When you're under stress, the body releases more cortisol, a hormone that can disrupt the balance of reproductive hormones. Elevated cortisol can alter the timing of ovulation, causing periods to arrive earlier or later than expected, and it may also make menstrual bleeding lighter or heavier. With ongoing or chronic stress, ovulation may stop altogether, leading to missed periods. From an evolutionary perspective, the body may temporarily pause reproduction during times of stress, interpreting high cortisol levels as unsafe conditions for pregnancy. Once stress levels decrease, menstrual cycles often return to their normal pattern. Emotional stressors such as anxiety, shock, grief, and major life changes, like exams, moving, or relationship difficulties, can also affect the hypothalamus, the part of the brain that regulates the menstrual cycle. When you lose weight rapidly through intense dieting, an eating disorder, or extreme exercise, your body enters survival mode. Generally, the body needs a minimum of about 22% body fat to maintain a regular menstrual cycle. If you dip below this, your period may become light or disappear entirely, a condition called amenorrhea. Gaining weight quickly can also be just as disruptive, but for the opposite reasons. Fat cells produce a type of estrogen. If you have excess fat tissue, your body may produce too much estrogen. The high estrogen levels trick your brain into thinking you've already ovulated, or that it doesn't need to start a new cycle, leading to missed or very heavy periods. Excessive or intense exercise can delay a period. When the body senses that energy demands are very high, it may reduce the release of reproductive hormones from the brain to conserve energy. This can delay or suppress ovulation and menstruation. This is more common in athletes or people who combine intense exercise with weight loss or low body fat. All of these disruptions of reproductive abilities are usually reversible after varying periods of time, following weight gain, decreased athletic training, or both. PCOS can cause hormonal imbalances that often lead to irregular or missed periods, along with symptoms such as excess hair growth, acne, and weight changes. The thyroid regulates your metabolism and hormone levels. Both an overactive and an underactive thyroid can affect your cycle. During the first few years after menstruation begins, it's normal for many adolescents to have irregular cycles, which can sometimes last several years as hormones mature. Later in life, women in their late 30s or 40s may begin transitioning toward menopause, a phase that can also make menstrual cycles more irregular and unpredictable. Starting, stopping, or even missing a few doses of hormonal contraceptives, pills, injections, can cause spotting or missed periods. Also, emergency contraception, often called the morning after pill, contains a high dose of hormones that can shift your menstrual cycle by a few days or even a week. In addition, certain antidepressants, Antipsychotics or chemotherapy drugs can interfere with menstruation. Prolactin is the hormone responsible for milk production. During breastfeeding, high prolactin levels suppress ovulation, which can delay periods. In some women, menstruation becomes irregular or stops completely while breastfeeding. Although fertility is reduced during this time, breastfeeding does not guarantee protection from pregnancy, and ovulation can occur before the first postpartum period returns. A severe sickness, such as the flu or a high fever around the time of ovulation, can delay ovulation and push your period back. Most doctors don't worry about one late period, but you should see a healthcare provider if you miss 3 periods in a row, have severe pain or heavy bleeding, suspect pregnancy, or notice new symptoms like excess hair growth, severe acne, or unexplained weight changes.